On Afterwards, nurse and New York Times columnist Theresa Brown discusses her book, The Shift: One Nurse, 12 Hours, 4 Patients' Lives, which gives readers a first-hand account of her experience in patient care and safety. Ms. Brown is interviewed by Debra Hatmaker, Executive Director of the American Nurses Association.
It strikes me as very, very strange that nurses don't learn in nursing school how to work with doctors, and doctors don't learn in medical school how to work with nurses. But then you put these two groups together on the hospital floor, and that's how patient care happens.
Exactly.
Is those two groups working together. So I'm not sure why anyone thinks this is a really good way to achieve the best results possible.
Right.
So as you said, there are programs that are now starting to focus on interprofessional education, and that is a great start. I think for each of us to have empathy for the other makes a huge difference. I mean, I read books by doctors partly to know what they're thinking, what they're doing, and I would love it if doctors would look at writing by nurses, try to find out what is it that we're actually doing all day, get a sense of how we're trained, what we're able to accomplish. I mean, I'm thinking of a story where we had a patient who was doing very badly and did not want to go to the ICU, but we didn't have a do not resuscitate form that said that was okay. So,
and to explain what do not resuscitate may mean.
Right. So at this point, the patient was basically making a choice between, do I want more aggressive treatment or do I want to just have my symptoms managed? And that's more a direction going toward hospice.
Right.
What the patient wanted was to not go to the ICU, to not have aggressive treatment, but without this form that said, I don't want the aggressive treatment, our hands were tied. So we were calling the intern and resident, the younger doctors who were learning the job, and they kept putting us off and putting us off and putting us off. And I was helping out a much newer nurse. And finally I called them myself and forced the issue and said, we really need you here. What's going on? And she said, we're dealing with a crisis across the hall. And that was so helpful because then we knew they weren't just in a meeting, they weren't just blowing us off.
Right.
They were actually in the middle of something that was just as hard for them as what we were going through at the same time. And then because she had told me that, then we could work out a plan, and they came over as soon as they could, and we got the form filled out, and it worked. But neither side, and saying side is revealing, right?
Yes.
Neither group is all that good at explaining to the other what's pulling us in a million different directions.